This presentation is a support to our Texas Superior Health Plan family judges and attorneys. This session is an overview of the health plan benefits and contacts to support children in foster care in Texas relative to their health coverage. Star Health is part of Superior Health Plan, which is part of Centene Corporation. Superior Health Plan also supports other versions of Medicaid and Medicare. Today, we are here to share with you the specifics about Star Health Foster Care Medicaid, and we hope it supports you in your work with children and families. Superior provides health care for Texans enrolled in Medicaid, CHIP, Medicare, Medicare Medicaid Plan, and Healthcare Marketplace Exchange. General health screenings will now screen for severe emotional disturbances for children with special health needs. STAR service coordination duties include ongoing support and education about the appropriate use of emergency department, completing court orders involving health-related concerns, identifying health-changing conditions that warrant case management support, identifying and addressing preventative care and gaps in care, and making referrals to waiver programs. Superior offers service management. Members who may benefit from service management support are members in a hospital, who have scheduled surgeries, who are receiving life-sustaining services or treatments, or who are using specialty medications. Screenings are completed within 30 days for all new Superior Star Health members. The items and services we are going to talk about here are integrated services in the sense of physical health care and behavioral health care coordination. As soon as a child comes into the conservatorship of DFPS or CPS in Texas, the Access to Managed Care Organization programs and benefits initiates. It starts with a welcome call, which includes a telephonic health screening. This helps the member advocates and member connection representatives get a lead on the current needs and forecast for needs and connections. Sometimes the telephone health assessment reveals a need for specialized services for serious emotional disturbances. There is complex case management. Members are identified as having uncontrolled, catastrophic, highly complex conditions. This may be in an inpatient facility or have complex medical or behavioral health conditions. There is a transitioning youth program, adolescent to adult, a program offering reward dollars to young adults who complete wellness visits, dental checkups, and other health screenings. And this is for 18 to 21-year-olds. There is discharge planning. Staff provide intensive transitioning planning, ensuring adequate services and supports are in place upon transition, confirms post-transition placement, provides linkages to new providers if pre-post transition placement differs, and follows up in person or via phone within 3 business days of transition to identify any further gaps in care and ensure services are initiated and meeting the child's need. There's Smart Start for your baby. This team manages our award-winning pregnancy postpartum management program, which improves prenatal care access and pregnancy and birth outcomes for moms and babies. All pregnant Star Health members are enrolled, not just those with high-risk pregnancies. Members are assessed for special needs, ongoing education, assistance, and support on prenatal postpartum care and taking care of a newborn, and referrals are facilitated to appropriate providers or specialists. There is transplant coordination. Staff work closely with appropriate providers to obtain necessary clinical information and required lab work to facilitate timely evaluation of transplant candidates and assist in processing prior authorization requests for transplant services. They assist members in coordinating needed care and transportation and lodging for out-of-town evaluations or procedures. Transplant staff follow up members for up to 12 months post-transplant. Diabetes dual cases. Behavioral health and physical health nurses work together and develop an integrated service plan with goals to address physical health and behavioral health needs and improve appropriate utilization by facilitating specialist referrals and linkages to community resources. There's the Smart Nutrition and Activity or SNAP program. This is a program to improve body mass index for obese and overweight members with risk factors such as antipsychotic medication use and Down syndrome. Staff will assess height, weight, daily physical activity, and nutritional intake, confirm current physical and behavioral health diagnosis and medications, and develop with the member and caregiver or consenter a service case plan and healthy behaviors care plan to improve nutrition and physical activity. There's personal care services. PCS services allow for attendant services to complete activities of daily living for members that have an inability to complete these tasks independently or on an age and cognitive appropriate level. We also offer disease management. For asthma, members with uncontrolled asthma indicators receive close monitoring, coaching, and extensive care coordination. And for intellectual and developmental disabilities members, behaviors associated with IDD diagnosis can mimic symptoms of a behavioral health diagnosis. A designated behavioral health clinician with IDD expertise works with the member and caregiver or consenter to link them with providers who are knowledgeable about IDD. They also educate caregiver or consenter about the diagnosis and facilitate any access to needed Medicaid waiver programs. Since many children with IDD also experience comorbid medical conditions, the behavioral health service manager co-manages cases with registered nurses to ensure appropriate physical health input and coordination. The state of Texas took a very specific operational approach to the physical health and behavioral health integration. The 3 and 30 program reinforces the value of completing 3 specific assessments within the first 30 days of placement. They are as follows. By the 3rd business day into care, a child needs to have been evaluated for any non-urgent health care needs by a medical provider. Within 30 days of coming into care, the medical consenter needs to have completed the first of the Texas Health Steps. This includes physical and dental Texas Health Step components. The third item of the 3 and 30 is the completion of the CANS 2.0 comprehensive assessment. This allows for a strength-based psychosocial assessment by a Superior Star Health Network provider that is either an LCSW or an LPC or a psychologist. Under current law, children in DFPS care must receive the assessments noted within 30 days of removal. Effective December 31, 2018, children and youth will be required to have an initial medical assessment within 3 days of coming into care. By combining the statewide implementation of the newly required medical checkup and CANS assessment, DFPS can have a greater understanding of the needs and strengths of children and youth in care. This 3 and 30 is a collaborative between Texas Department of Family Services, Texas Health and Human Services, and Superior HealthPlan, the managed care organization for children and youth in foster care in Texas. The Texas CANS serves as a comprehensive psychosocial assessment, trauma screening, and suicide screening. For youth in the CPS system, the Texas CANS 2.0 is a guide for service planning and determining levels of care for youth in foster care services. John Lyons is a senior policy fellow at Chapin Hall. He is the developer of an outcomes management approach for human services called Transformational Collaborative Outcome Management. Within the TCOM framework, the most commonly used tool is the Child and Adolescent Needs and Strengths, or CANS, which supports the decision-making in child welfare, mental health, juvenile justice, schools, and early intervention service provision, including level of care and planning and well-being and functional status outcomes, to facilitate quality improvement initiatives. Versions of the CANS are currently used in every state with statewide applications in 36 states. There are implementations on every continent except Antarctica. The 3 and 30 is from Senate Bill 11. The goal is to remove barriers to care. To schedule these services, call Superior. You can speak with member services, service coordination, service management. And if you don't have an ID card, you can call us and we can help you in real time. It has been our observation that from time to time, court services sometimes have issues or concerns surrounding these items. Let's look at how to address these. What program component reveals health conditions? The Texas Health Step, sick visits and dental visits. What program component reveals trauma history? The telephonic health assessment, the PHQ-9, and service coordination and service management. What program component reveals medication needs, adherence issues, and opportunities to reduce pharmacology? The telephonic health screening, the Texas Health Steps, the CANS or Child Assessment of Needs and Strengths, and the Psychotropic Medication Utilization Review, Service Coordination, and Service Management. What program components support long-term well-being? The A2A, the Psychotropic Medication Utilization Review, and the Texas Health Steps. What program component supports hobbies and interests? Sports physicals, value-added camp, and hobby forms from CPS clinical social workers. What program component helps with consent or questions? The nurse advice line, service management, service coordination, member connections, the psychotropic medication utilization review, staffings, and the CANS assessment. For assistance, any authorized caller can contact Member Services at 1-866-912-6283. Assistance is available 24 hours a day, 7 days a week, 365 days a year. Caregivers should report star health barriers to the assigned DFPS caseworker. DFPS caseworkers should report star health barriers to their regional well-being specialist. Details of the barriers are important to include, such as who at Star Health they spoke with and when, so resolutions can be expedited. The DFPS Regional Wellbeing Specialist will escalate an inquiry into their designated Star Health liaison for internal review. Upon research or resolution, the Star Health liaison will report back to the DFPS Regional Wellbeing Specialist the findings or case update. If concerns remain unresolved or if dissatisfaction is expressed, complaints can be reported to the Star Health directly by calling 1-866-912-6283 or by contacting Texas Health and Human Services by calling 1-866-566-8989 or emailing HPM complaints@hhsc.state.texas.us. There are Medicaid cover services, and they can be assessed without a court order as long as they are medically necessary. If services are needed with a specialist, a referral may be required by the primary care provider. There are non-Medicaid covered services. Superior does not pay for non-Medicaid covered services. Court-ordered non-Medicaid covered services become the financial responsibility of DFPS. For orthodontia, this must be medically necessary for Superior to pay. And placement. Placement is not a Medicaid covered benefit and cannot be paid for by Superior. Caseworkers must contact their regional well-being specialist to begin the court-ordered placement process. For any questions or more information, please reach out to Superior Star Health at medquestions@superiorhealthplan.com. Thank you for listening to this overview of the health plan benefits and contacts to support children in foster care.